Hello. If you care for people with dementia, you may have experienced them repeating words, phrases, or questions. The person with dementia might repeat words or phrases, repeat questions about the time of day, appointments, or past events. Tell the same story several times in a single conversation. Repetitive questioning can be frustrating for carers and families. Even the most well-intentioned carer or healthcare professional may feel overwhelmed at times. There are a number of reasons why a person with dementia may ask the same question over and over again, sometimes within minutes. These include memory loss. They may simply have forgotten that they asked the question, or they may have forgotten the answer. Anxiety. Repetitive questioning is often misunderstood as a need for information, but it is more often a need for reassurance. Imagine how frightening and confusing the world would seem if you had difficulty understanding how one event in the day leads to the next. You may worry about the future if you could not process tasks in a logical sequence. Boredom. It may be that the person with dementia has been on their own, sitting doing nothing for a long time. They then seek attention, just as a child would. Stress. If the environment is crowded, noisy, busy, the question, "When are we going home?" might be their way of expressing that they're overwhelmed. Figuring out what the question means can be a guide to knowing how to handle it. With that in mind, here are some suggested ways of dealing with repetitive questions. Remain calm. Avoid shouting and getting cross. This can be very difficult at times, but remember, this will only increase the person's distress. Orientate the person with dementia to the time, day, date, and location. This can be done by using the person's name frequently, discussing current events, referring to clocks and calendars, placing signs and labels on doors and cupboards. Asking family members to provide a simple family tree or photograph album with clear labels. Change the subject. Talk about something that happened during the day, or point out the window and talk about what's outside. Take the person away from the stressful, noisy, or unfamiliar environments. Distract them by asking them to do something easy but useful, such as laying the table for lunch. Sometimes it may be best just to answer the same question over and over again. In that case, speak slowly, loudly, and clearly, answering very simply. Remember that dementia affects everyone differently, and it can take a while to work out what's best for any one person in a given situation, especially as the disease progresses.